It's Dr. Marion Owen, and I'm here with my husband, who is going to help me do a brief presentation for you about this article from the New York Times. Why are so many people popping vitamin D? And as I was reading this article, I had a running, somewhat humorous commentary in my head, and I thought maybe it would be fun to let you guys hear what I'm thinking as I'm reading things like this written for popular consumption that are critical of the things that I do. So if you want to skip this and not listen to all the breakdown, the upshot is I think that this article is totally wrong. I think that the way that we manage vitamin D in our office is completely safe and necessary and helpful to you. Now we're going to go through the blow-by-blow. My husband, Judd Owen, has agreed to read for the author and pause every now and then when my brain needs to expound a little bit on what the author has shared with us.
All right. Why are so many people popping vitamin D? And I have to observe I like the name of the author, Gina Colada.
I hadn't noticed that.
Yeah, and this was, by the way, among the most, it still is among the top 5 most emailed articles in the New York Times since its publication 5 days ago. All right. There was no reason for the patients to receive vitamin D tests. They did not have osteoporosis. Their bones were not cracking from a lack of the vitamin. They did not have diseases that interfere with vitamin D absorption.
Stop there. So you don't have osteoporosis, so I shouldn't check your vitamin D. I should wait until you have osteoporosis to check your vitamin D level, which prevents the development of osteoporosis. There are some diseases that do cause poor vitamin absorption that have very few other symptoms. And until you have a disease, I wouldn't know you have it if I don't check a representative vitamin level. And vitamin D is relatively cheap and affordable. It represents the absorption of all fat-soluble vitamins, and it can indicate both the need for vitamin D and indicate for need for further investigation of why you're not absorbing fat-soluble vitamins. So waiting for you to have osteoporosis and your bones cracking is already, we see that the author maybe has an agenda.
Yet, in a recent sample of 800,000 patients in Maine, nearly 1 in 5 had had at least one test for blood levels of the vitamin over a 3-year period. More than a third got 2 or more tests, often to evaluate such ill-defined complaints as malaise or fatigue.
And stop again. So I don't have a double-blind placebo-controlled studies for this, but when I did start checking vitamin D to prevent osteoporosis predominantly, and I noticed that patients had low D, and I corrected them up to a reasonable level, people would come back to me and say, I'm feeling a lot more energetic. These aches and pains that I've been having are better. So yes, they're ill-defined complaints that we don't really have a lot of good treatments for, besides maybe ibuprofen, which isn't good for your stomach. And if vitamin D is going to help you, I think that's great.
The researchers who gathered the data, Dr. Kathleen Fairfield and Kim Murray of the Maine Medical Center, were surprised. Perhaps they shouldn't have been. Millions of people are popping supplements in the belief that vitamin D can help turn back depression, fatigue, muscle weakness, even heart disease or cancer. In fact, there's never been widely accepted evidence that vitamin D is helpful in preventing or treating any of those conditions.
Stop. What constitutes evidence for this author is what I want to know. There are many, many studies that indicate a connection between low vitamin D and the probability of developing quite a few different cancers. There's very strong evidence, in fact, that it probably prevents colorectal cancer, at least. There's emerging evidence for some other cancers. And it's a harmless intervention. So I'm not talking about giving you a medication that's going to cause, diabetes like Lipitor will. I'm talking about an intervention that has absolutely no risk, although we'll get to that in a minute, and is very inexpensive and perhaps life-changing.
But so firm is this belief that vitamin D has become popular even among people with no particular medical complaints or disease risks, and they are being tested for vitamin D quote-unquote deficiency in even greater numbers. The number of blood tests for vitamin D levels among Medicare beneficiaries, mostly people 65 or older, increased 83-fold from 2000 to 2010, according to the CDC. Among patients with commercial insurance, testing rates rose 2.5-fold from 2009 to 2014. Labs performing these tests are reportedly are reporting perfectly normal levels of vitamin D, 20 to 30 nanograms per milliliter of blood, as quote-unquote insufficient. As a consequence, millions of healthy people think they have a deficiency, and some are taking supplement doses so high they can be dangerous,
It's underlined.
Yes, it is underlined, causing poor appetite, nausea, and vomiting. Although I think that, to be fair, that's a link to some.
Oh, that's a link.
That's a
Okay.
hyperlink.
Okay, it's a hyperlink.
Vitamin D overdoses can lead to weakness, frequent urination, and kidney problems.
We're going to stop there. So just because some people misinterpret a lab value and over-apply a solution is a reason that none of us should, in an intelligent and measured and careful way, measure a lab and perhaps address it and get your level to the level required to stop bone turnover, which is what we aim for at my clinic, usually around 55 to 65, not the low 20 to 30 that he is citing in that study. So because some people might overdose on something like, I don't know, heroin or Vicodin or methadone, and the heroin's not, but the other things can be prescribed by your physician. You know, people overdose on things. People do things that are not intelligent, not following the guidance of their physician. That doesn't mean it's not useful in most people who do it appropriately.
Quote, a lot of clinicians are acting like there's a pandemic of vitamin D deficiency, said Dr. Joanne E. Mason, a preventive medicine researcher at Brigham and Women's Hospital in Boston, who helped write an Institute of Medicine report on vitamin D. Quote, that gives them justification to screen everyone and get everyone well above what the Institute of Medicine recommends, unquote. In fact, the Institute committee on which Dr. Mason served concluded in 2010 that very few people were vitamin D deficient, and noted that randomized trials had found no particular benefit for healthy people to have blood levels above 20 nanograms per milliliter.
Going to stop you. So there's a lot of problems with the IOM report. And one I'd like to point out is from 2010. That's 7 years ago. There has been some progress since then that maybe the author doesn't want to look at. But regardless, in the IOM report, they recommend high doses of calcium, which have since the time of that report, have been shown to associated with increased risk of coronary artery disease, so heart attacks, strokes, that sort of thing, and increased risk of breast cancer, at least, and maybe other cancers. So something we want to avoid. And they underdose the target for vitamin D. There's a wide safety margin for vitamin D. So they're saying anything over 20 is fine, but you really don't get toxicity till well over 120, according to most labs, but really 150, even 200 before you see any symptoms of that. I never encourage patients to go that high. But there are definite benefits that you see in terms of bone metabolism that you can measure that you start seeing at around the 55 to 65 level for most people.
Medical organizations, too, some doesn't mention which, have repeatedly found that there is no reason to assess vitamin D levels in healthy adults. And recently, 2 rigorous studies failed to find that high doses of the vitamin protect against heart disease or cancer. Still, vitamin D has become, quote-unquote, a religion, said Dr. Clifford J. Rosen, an osteoporosis researcher at Maine Medical Center Research Institute and a member of the Institute of Medicine's committee.
Okay. So backing up just a little bit, I do want to say that the standard for the Institute of Medicine study was if you had a double-blind placebo-controlled study, it was accepted. Most other evidence was ignored. And on things like large population-based things that you're monitoring for a long period of time or might have their benefit over 20, 30 years, those types of studies just haven't been done, aren't designed to be done. I don't anticipate any being done. So if there aren't any randomized controlled trials, the conclusion of this committee is then there is no benefit. And that's just not how we do things in medicine. On the point of cancer, there is strong data that vitamin D is associated with a decreased risk of colorectal cancer. So the most common cause of cancer death in men and women. But it's not conclusive data. There's no randomized controlled placebo studies But there's really strong data. And, if I can prevent that, that sounds pretty good. And if I can do no harm while I'm doing that, that seems reasonable to me. There is good evidence that vitamin D reduces not the incidence of breast cancer, but the aggressiveness of the breast cancer in people with higher vitamin D levels. So women with higher vitamin D at the time of their diagnosis have lower morbidity, meaning problems resulting from the cancer, and lower mortality. Again, a very common cancer. Vitamin D's levels better, the cancer might not be as bad for you. Sounds like a good thing to me.
Vitamin D is a fat-soluble nutrient needed to absorb calcium and phosphorus, and therefore to make bones strong. People do not make their own. We need sunlight to synthesize vitamin D. The vitamin D also is found in oily fish and in a few other foods, including milk, which is fortified with the vitamin. Because many people have little exposure to sunlight, especially those living in northern climates in winter, some investigators became concerned more than a decade ago that large swaths of the population were not getting enough vitamin D. One is Dr. Michael F. Hollick, a professor of medicine, physiology, and biophysics at Boston University School of Medicine, and a leading proponent of the idea that just about everyone needs a vitamin D supplement. He points to studies that suggest an association between low vitamin D levels and higher rates of various diseases. While these observational reports do not prove cause and effect, he is persuaded by the fact that many point in the same direction, hinting that low blood levels of vitamin D are hazardous. Doctors, he believes, must take action. The recommended daily allowance is 600 international units up to age 70, and 800 international units for people who are older, Dr. Hollick said. Diet cannot provide that much of the vitamin, he notes, and it would require nearly constant exposure to sunlight to reach the levels he recommends. Over the years, he acknowledged studies in which people were randomly assigned to take a vitamin D pill or placebo have failed to support claims for the vitamin's benefits. But those studies tended to be too small to be definitive, he said. That's the end of the article.
No, it's not.
Oh, it's not.
It's not the end of the article. But the line diet cannot provide that much of the vitamin. That is true. Milk is fortified with vitamin D2, which has association with health in calcium metabolism and bone health, but doesn't necessarily have the data for cancer prevention and cardiovascular benefit. So I don't recommend trying to get it by drinking a ton of milk because you're going to get too much calcium that way. And Hollick does not say that it would require nearly constant exposure to the sunlight. When I heard him lecture, he says 15 minutes, arms, legs, and face every day. And if you live south of the Mason-Dixon line, as you do if you're my patient, we'll get that need met.
Oh, I see. It looked like it was the end, but really there's this picture of someone eating a meal made exclusively of vitamin D, apparently. All right.
Because that's what crazy people who take supplements do. They just
Right.
eat a plate full of supplements.
Right, with coffee.
With their coffee.